Katie here. Happy March and the first Friday of the month. And if you don't know, I usually do a support call at this time at 1 o'clock. Nobody showed up today, so I'm going to give you some additional tips from Dr. Khan's presentation that I watched yesterday. And these are the ABCDEs of heart health. Super simple to remember, but super important. And the number one A I thought was great was just awareness, which is what I'm bringing to you all, which again, I feel like he had such a valid point that we check for a lot of things, but the heart is not on the list, and it's actually the leading killer of adults, or of everyone. So basically, especially as you get older, it's something you want on your radar. He also put in the A category aspirin, but that's only once you've had your CT scan. Once you find out your calcium score, if it's above 0, then you want to start doing some mediation things. And again, what's so great about all these is once you have the knowledge, there are definitely things you can do to reduce your risk of a heart attack. You can, actually absolutely reverse some of these illnesses and diseases. So super great there. But sometimes, aspirin is a known thing to help prevent heart attacks, but you need to know if you need that. So don't just start taking aspirin willy-nilly. But that's under A. B, he talked about blood pressure, and he basically advocated for everyone to get their own blood pressure machine and take it, once a month. So again, I advocate for you checking your breast once a month. Another thing you could do, you could have like a checkup day, where you do your self-care and your self-health, and check your blood pressure. Now, he recommends you take it more than once. You get a machine that does it for you. Test it 3 times, and then pour more attention on that third one. If you do even 2 back-to-back, you're going to get different numbers. Sometimes you're even stressed out and nervous about doing the test or whatever. But take 3, and either take the third one or, average them out or whatnot. But that's what he recommends every 100 days. That's B. C is your cholesterol score. And this is something, again, Dr. Jen said, why is it, and me as well, when I first got my HA1C, I think 2 years ago, about a year ago, or I can't remember now. But the bottom line is this is a test that I hadn't had. Nobody was asking me to do it or whatnot. And I discovered that I was pre-diabetic. What? The great news is that with diabetes, you can reverse diabetes and you can avoid getting diabetes in the first place. So super great news to know. But you kind of need to know, again, what your score is, whether, if you're becoming insulin resistant. So that was the case with me. You could better believe I changed my diet. I changed things. My next test was in the go mode, was no longer in the pre-diabetic range. So, but again, if you don't have the scores or you don't have the test, you don't know. So find out your blood pressure, and then the next thing is find out your cholesterol score and whatnot. And it's not necessarily a bad thing if you have high cholesterol, depending on, again, your other scores. And then, of course, this is sort of a no-brainer for me, but no cigarettes, right? If you're smoking, stop. I don't care, what you have to do. Get into a program, a cessation program, stop smoking. It just doesn't make sense. It's so bad for you on every level. So I know it's hard, but it can be done. And then D is for diet and also diabetes, which again, back to the getting your diabetes score. But once you know that, take care of it with your diet. You can take care of so many things with your diet. A lot of what I teach is about diet. E, exercise. Again, I thought, we're hitting the big categories here. My 7 simple steps. Exercise is one of them. Gotta do that exercise to keep that heart healthy. And then he also mentioned, this is the final one, if you need an echocardiogram, if you find that your score is high, that might be something that you need. So those were his A to E's of heart health. Hope that was informative. Hope that puts it on your radar. Take care of your heart health. It's super important, just like we take care of our breast health. All right, ladies, take care. Bye.